Hi everybody, it's Paul Feuerstein, and I'm here with Dr. Robert Gregg.
Hi,
Robert,
Paul.
how are you?
Good to see you.
And I hope all of you know about Millennium Dental Technologies with the PerioLase, what's the actual model number?
MVP-7.
MVP-7, latest model, and what it does for dentistry. And when you say laser, you think, oh, it just cuts, this is not what this does at all. Robert has developed something called LANAP, and why don't you just talk about that for starters?
Well, LANAP is a procedure-based laser protocol. We emphasize the procedure, not the laser. And it's been around for almost 30 years. Yeah. And it's taken us a while, but we're pretty mature in the development of our protocol, having done a tremendous amount of research, human histology. The protocol steps back here for both LANAP and LAPIP have stayed the same since 1992. So that's a tried and true clinical result experience that we developed, and then we went out and did the research at universities to get the histology, human histology studies, but also a multi-center prospective study showing the clinical efficacy. So we translated the academic to the clinical environment, even though we were already doing clinical stuff before those studies. So
just in the basic information is that we like to look at lower anterior teeth. You have a lot of bone loss, and some of the teeth starting to get some mobility. So what does that LANAP do to that? And we'll talk about the other thing.
Well, we've proven with histology that we regenerate the entire attachment apparatus, meaning bone, ligament, and cementum. And that's revolutionary. There's no other laser that's been proven to do that. And that's unique to our company.
And now we're in the world of implants, and this fancy word peri-implantitis shows up, and everybody's like, well, let's just rip out the implant and put in another one.
Yeah.
But give it a chance here.
Yeah, same thing. LANAP and LAPIP are for hopeless teeth and implants now. And we don't have to cut away the tissue to get access to the implant. We do it through the pocket and using our design tips for scaling to clean the implant surface and use the laser to regenerate the bone, activate the growth factors, and see the threads get covered up again.
And I can just say from my own experience, we've had a few patients that had fatal implants. And I said, there's a periodontist right near my office who has this system, and they come back and I go, did you do a bone graft? They go, no, this is now. Yeah, no exogenous materials, no grafts, no biologics. You don't need that stuff, it's very expensive. And this laser does all of that and more with a minimally invasive approach through the pocket. It's a biologic approach too.
Yes, it is.
That's the thing. It's like the difference between having a knee replacement versus somebody using something to regenerate the knee, regenerate the cartilage, things like that.
We've actually had some personal anecdotes of regeneration of cartilage in the knee with our son who had a delamination of his cartilage. So he was using this through the skin.
Wow.
And regenerated his cartilage, but he had a little help.
Yeah.
I mean, with the orthopedic surgeon, but we accelerated the wound healing on that. And there are studies that show histologic regeneration of lost cartilage following Nd:YAG biostimulation or PBM.
Well, I mean, that's the short story. So if someone wants to learn more about this, what's the website they should go to learn more about LANAP?
Yes, it's LANAP.com.
Simple as that, LANAP.com. Yeah. Robert,
thanks so much.
Hey.
Always good to see you.
Hey, great to talk to you.
Yes.
I always learned something else today. I learned something today. Thanks a lot.
Awesome, thank you. Thanks, guys.